Probably helps if I turn the microphone on, doesn't it? All right, so things are now getting to where we want them to be. We just need to do one or two more shares here to get everything to our groups and everywhere else where we like it to be. Make sure that I can actually see the most, if not all, the comments as they come flying through here. Flying through like I'm some kind of Facebook or streaming celebrity or something like that. So, all right, so that's the watch party, and we got to get the video shared to our group here on Facebook, and then we'll get started. So, in about 2 more clicks, we will get rolling. Facebook gives me any cooperation at all. Here we go. All right, so COPD Navigator. And what the heck, we'll share it with some of my readmission buddies also. All right, so that's how we do. Good afternoon, James. For those of you who may be new to watching this strange gentleman in his sci-fi oriented studio, my name is Mike Hess. I have been a respiratory therapist since 2006. I have been a registered pulmonary function technologist for about 2 or 3 years now, and I have been a COPD educator, advocate, navigator, whatever title we want to put on it, for about 5 or 6 years now. My usual role is to do online presentations about every 2 weeks or so on a particular topic, including the latest news in the world of COPD, about a half hour or so on a particular topic, whether it's inhaler usage or inflammation or non-medicinal ways to treat COPD, whatever it is, and then take some questions and answers at the end of that. Considering where we are with this whole novel coronavirus situation, and that many people do not have access to their traditional methods of information, whether it's your primary care provider or your pulmonologist or your pulmonary rehab facility, whatever it is, a lot of those things have kind of shut down for right now, and it may be difficult to get the information you need and to get the social connection, social interaction that you want. That is very helpful in these trying times. So that's kind of my goal with these presentations. I have a group here, or a group on Facebook. Can't say here anymore because we're also on YouTube. I have a group on Facebook called COPD Navigator, where we have a whole bunch of people living with COPD and caregivers and clinicians of various stripe, who all get together and share stories and share tips and all that kind of stuff and share support. So we've been very fortunate to have that for 5 or 6 years now. It is certainly not the biggest community, COPD community on Facebook, but I really appreciate the effort that everybody has put into it, and to help it grow. So, with all of that said, let's see who else we got here. So we've got James checking in from out west. Good afternoon. I think I already mentioned that. Let's see where else. Where'd my clicky go? There we go. So this time basically is yours. I'm opening this up to general COPD questions. I don't really have a lot of news items right now. We are in the off week of COPD Navigator, or Breathe TV, excuse me. So I don't, I don't really have the usual lesson plan, but like I said, I know a lot of folks are struggling with getting resources and things like that. So that's why I'm here. I can't offer you medical advice. I can't tell you specific to your case what's going on. But what I can do is make sure that you are aware of the best practices and aware of what hopefully should be going on, so that you can check with your clinical team and then find out if there are things that maybe can be tweaked a little bit while we are going on this crazy adventure with viruses and such. So hopefully that's not too loud. I've gotten surprised a couple of times at just how sensitive this microphone is. So let's see. So there we go. We got a couple of people, also other people checking in. We've got Phil checking in. Good late afternoon, early evening. Gloria checking in, longtime member of our Facebook group, COPD Navigator. Gabby Davis, hello. Potentially seeing you back here in Michigan someday soon, hopefully, maybe. Linda checking in. You are very welcome. And yes, it absolutely is a struggle. It's one of those things that I try to avoid the phrase, I know how you feel, because I don't. I don't deal with that kind of chronic ongoing shortness of breath all the time. But I understand it academically. I understand I understand that it is a burden and what kind of burden it must be. So that is part of what drives me to try to provide these kind of resources wherever I can. So I know it's not easy, particularly in a time like this when, one of the biggest issues I've been seeing personally is that while this novel coronavirus is certainly a big deal, and it is certainly very important, a lot of people seem to be forgetting, a lot of people in higher up type situations seem to be forgetting that there are still a lot of other things going on too. People with COPD, people with asthma, people with cystic fibrosis. All of these conditions are still running their normal courses as well, while all these other resources and things like that are being diverted to attack this coronavirus. We've got to remember that we've still got a whole bunch of other people to take care of too. And you are still going to be around after this coronavirus crisis, and we're still going to need to be taking care of that. So we cannot take our eye completely off the ball of these chronic conditions. We should be able to manage doing both at once. Unfortunately, we're seeing that our health system is really strained right now, and we're forgetting some of the basics in there. So not to get too soapboxy, but that's kind of where I'm coming from here. That's where I'm at. That's what I'm about. So let's see. We got, like I said, this is your time for questions and all that stuff. Hello, Rachel. Thank you for checking in. Appreciate everybody stopping by. So if you've got questions about COPD, if you've got questions about coronavirus, like I said, this is time that belongs to all of you. And that's about that. I guess if we have dead air here, then I guess that's the way it goes sometimes. It's trying to do, this is I guess what I need to learn about radio is sometimes you got to have dead air, and sometimes when you have a live show it can be tricky. There we go. Linda has a question. What can we talk about, Linda? Go ahead and get that typed in. Again, anybody else, if you're watching on Facebook, YouTube, wherever, go ahead and get those questions typed in. I have most of the bugs worked out for most of the windows here. I can see the questions fairly quickly. Also, one thing that I have been somewhat neglectful of, but if you happen to be a Twitter type person, you can tweet a question at COPD Navigator. Just trying to pull it up real quick here. Just look for this account on the old Twitter machine, at COPD Navigator. That's me. So go ahead and get questions in there. I'll be keeping an eye on that to see if we can get any questions answered there, or as I said, drop them in the comments here like Linda is about to do. Do we have to be maniacal about using wipes at home? Well, I'll tell you, everything that I have seen said that cleanliness is very important right now. It's going to depend on your individual situation, because if you are the only one that you have contact with, which is certainly understandable at a case like this, then you know very well where all of your contacts might be. If you have other people coming in and out, or if you're bringing groceries in and out, that can be a little bit tricky, and that's where you want to be a lot more concerned about cleaning surfaces and things like that. I would still be, especially at home, I would still be more concerned about washing hands for 20 seconds. Um, that would be the biggest concern. Trying to keep your counters and surfaces and things like that as clean as possible. I wouldn't necessarily say maniacal, but be diligent. I would say is an appropriate word to use there. Be diligent, especially if you have, for example, if you happen to get something from Amazon, or if you have grocery service, grocery delivery, something like that. Put stuff on the counter, unpack it, all that stuff. You're going to want to wipe that down afterwards with a good wipe, or even soap and water. Soap is going to kill off. What the soap does is it breaks down the envelope that surrounds the living, isn't necessarily the right word, but I guess the active part of the virus is surrounded by this fatty envelope. And when you use soap, it breaks that down, and then the virus can't survive outside that envelope, and then it's gone. If you can't use soap and water, including in your hands, then use at least 60% hand sanitizer, 60% alcohol hand sanitizer. There are a variety of Clorox wipes, Lysol wipes, all those sort of things. If you look on there, then they will actually say effective against coronaviruses. One of the things is, it's important to remember that while this particular coronavirus is new, it's kind of a misnomer to call it the coronavirus, because there are, I don't know, dozens. I don't know if there are hundreds, but there's lots and lots and lots of different coronaviruses out there that have been causing sickness before. Now, again, this one is distinct. It's different, and that's why there's a lot of issues. We don't have any kind of natural immunity like we do to various degrees with other coronaviruses. But things that destroy other coronaviruses will also generally destroy this one. So use your wipes, use your soap and water, all that stuff. I did see there was a follow-up comment there. I live alone, nobody here except me. So you can probably be a little bit more casual, and I'm sorry for touching my face there. I had a sudden itch. I'm still trying to break that habit. You could probably be a little bit more casual than somebody who has a lot of people coming in and out, and certainly a lot more casual than, for example, at a store, at a clinic office, things like that. Speaking of going to the store, Gloria brings up another very good question. Are gloves necessary to go to the store? And this is one of those things where you have to be really careful about how you use the gloves. One of the things that we have to, there's a lot of times where we focus on general details in medicine when we should be far more specific. It may seem like we're splitting hairs, but we're really not. For example, the analogy I've been using a lot lately, because I've been talking about this a lot, is spirometry testing. We emphasize that we need to have a lot of spirometry testing in these clinics and out in these offices so that we can find people who have COPD. And we do. But what we need is high quality spirometry testing. Similarly, gloves can be a good idea when you're going to the store, but you have to use them properly. The whole idea of gloves is to protect yourself from spreading stuff, whatever. So, for example, if you were to go to the store and put some stuff in your cart, and then scratch an itch on your face like I did a minute ago, the glove is now pointless, because the whole idea of the glove is to give you a coating on your hands that you can remove very quickly in case you need to do something else. That's why a lot of times you use gloves with meat and cooking and things like that, because say you're cooking two different kinds of meat, you can quickly take one glove off, give your hands a little wash, and then you're ready to move on and put some new gloves on, and you're ready to go on to the next one. That's why we do it when we go from patient room to patient room in a hospital, because we use gloves for the individual person. We remove the gloves, and we usually do hand sanitizer, soap as an extra layer of caution, but we're not carrying that surface into a different place. So this is kind of where sorry, I just had another comment pop up there. Kind of where using gloves inappropriately can give you a false sense of security. And I see we got a question about masks coming up too. Masks can also sometimes give a false sense of security if they're not being used properly. And there's been a lot of controversy about what exactly constitutes proper mask use lately, because the rules keep changing for a variety of reasons that I won't go into too much right now. So it's kind of a sticky area because it would depend on how many things you're going to buy. All in all, I think you would probably be better off going early in the day. Most stores are taking advantage of extra time. Like, for example, we have a regional chain in Michigan and throughout the Midwest called Meijer. They have been known for they've been open for 24 hours with the exception of Christmas since I can remember. I mean, since maybe when I was a little kid, they actually had store hours and stuff like that. They've been open in blizzards and polar vortexes and all that stuff. I can count on one hand the number of times, again, outside of Christmas, which is their tradition, that they've closed. In response to this coronavirus crisis, they have opted to go from 8 in the morning to 10 at night instead of being 24 hours. And they alternate. I think it's Mondays and Wednesdays. They open at 7 for high risk populations like older folks, people with chronic conditions, things like that. Tuesdays and Thursdays they open a little bit earlier for healthcare workers who are a different kind of higher risk. So where I'm going with that is my advice would probably be to go first thing in the morning because they're taking advantage of that time that they're now not open to do a deep clean and sterilize and wipe down all the carts and all that kind of stuff. So if you go very early, you're going to get something that's still fairly pristine. And then again, make sure you're frequently using hand sanitizer. Make sure you're frequently using soap and water if you can. Again, that's difficult in a store, but make sure you have that good hand sanitizer. Maybe have an extra wipe or two. If you have some stuff on, like if that makes you feel a little bit more comfortable. I have seen some conflicting advice from two different sources that I feel are reliable. One of them says don't worry so much about things living on boxes and things like that. One said that a brief problem with the video, I think, here. I'll keep talking, so I don't know if people will be able to see me too well, but here we go. So one source has said, don't worry about that stuff. Another source said, well, non-perishables, you should let sit in your garage or wherever, someplace safe for a couple of days and take everything out of boxes, things like that. My gut tells me it's probably more the maybe wipe stuff down, but probably don't worry about it too much because it's a little bit dramatic and that kind of stuff. To some degree, it's going to be whatever makes you feel safer, but I guess where I come down is probably not a no on the gloves. Make sure you're using other good hand sanitation techniques with the soap and water and all that stuff. And don't get too caught up because we talked a little bit about mental health issues and anxiety and all that stuff yesterday. It's really easy to get caught up in a lot of that. And then if you catch yourself forgetting to do something and that you have this whole whirlwind of, oh no, now I'm going to get it and all this stuff. I would probably err on the side of not stressing too much about that and just using some common sense stuff. So that was a whole big thing about going in a couple of circles here. So let's see, go. So as far as the mask goes, that's also up for debate. I'm seeing now that CDC guidance is saying that maybe we should be wearing masks out in public when we're not symptomatic. There's some thought that over in Asia, that's how they were able to control the spread pretty well because those societies are a little bit more used to wearing masks in public and things like that. It's going to come down somewhat to your strategy as far as whether there's a lot of talk now when our governor issued her stay-at-home warning. One of the things that led up to that was the idea that you should imagine that everybody is infected with coronavirus and act appropriately. Don't go out and don't act like you're not trying to get it. act like you're trying not to give it. Act like you're already infected. And that's standard guidance. The standard guidance for people who are infected with something is to wear a surgical mask, so that, because those are very effective at preventing stuff from going out. If you're wearing a mask and you cough, then it kind of bounces off the inside of the mask and mostly stays in with you, who's already contaminated, so it's okay. They don't often do a lot for stuff coming in from the outside because it's difficult to get good seals and all that kind of stuff. So again, it's hard to say. The guidance is changing all the time. Out in public, and again, it's kind of the false sense of security thing. There's some talk about how, if you wear a mask, sometimes you're a little bit more likely to be touching your face because you have that false sense of security, and that's a bad thing. So again, if you choose to wear a mask out, it has to be one that is going to do you some good. Dust masks, probably not going to do a whole lot. Surgical masks, some of the homemade masks may help to a degree. I still am not entirely comfortable with advising everybody to do it. I haven't seen really strong guidance from a reliable source that says we should be doing it. So it's a little bit up in the air. I'm a bit on the fence, but on the no side to general mask wearing, especially for if we're going back to grocery shopping and things like that. So that's where I'd kind of be at here. Saw somebody wearing mittens today. So, Linda, I do use disinfectant masks and the wipe that I got in the mail. It's not an N95 and it's loose. So it's probably one of those surgical mask kind of things. That could, again, it's up for debate. There's a lot that we don't know right now. If you wear a mask, don't touch your face. Make sure that you're cognizant of a lot of that stuff and don't fall into that false sense of security aspect of it. Mittens probably aren't going to do you a whole lot of good. Rachel checks in. Since I am young, I am afraid of taking advantage of special shopping hours. Does anyone know how those special shopping hours work? Well, from what I know, I don't know what all you mean by young or anything like that, or if you have other comorbidities or anything like that. The concurrent conditions that may put you at higher risk for immunocompromise and things like that, bad immune system. It's my understanding that most places that are offering the special shopping hours are doing it essentially on the honor system. I mean, as I'm sure I'm preaching to the choir here, not everybody can see that you have a chronic condition. Not everybody can see that you have COPD. Not everyone, you can't really see that you maybe have had a lung transplant. You can't really see that you might have cystic fibrosis. I mean, if you're in the clinical realm, there are certain markers that we can look for and we can maybe pick it out. But we're also seeing that one of the biggest concurrent conditions that is causing the most problems with really severe COVID-19, the disease that comes from this coronavirus, is diabetes. And there's essentially no way to see if you have diabetes, like just by looking at you. So generally speaking, it's my understanding that they're on the honor system. I have not attempted it yet. I can't say for sure. I don't work for any of those companies that have the special shopping hours or anything like that. So I can't say with certainty, but it's my impression. I appreciate you're being honest enough that you're not going to take advantage of it. But I don't know how anyone would stop you, I guess. I guess it's your ethical, moral compass that is guiding you in that direction there. So also I should point out 4:30. I know we talked a little bit about Right to Breathe yesterday. They're having a live seminar starting right about now over through their Facebook page. They're also going to be repeating it at 7 o'clock. So if you just can't get enough of COPD/COVID-19 information, you can hit up both shows. I certainly won't be offended if anybody wants to go check out what they've got offered right now. That's being put on by Michelle Da Silva, who is a fantastic educator, chronic long-term person living with asthma herself, so she knows a lot of what's going on with chronic lung conditions. So go ahead and check that out. James mentioned, saw this today from the American Lung Association. Good question and answer on asthma, COPD, and COVID-19. So hopefully that muted and unmuted properly, and I didn't blow out everybody's ears so far. COVID-19 myth busting with Dr. Juanita Mora, allergist immunologist in Chicago. So this actually does look really good. We'll go through it. Let's see, how long is this quickly? We got a couple here and there. Myth number one, again, this is American Lung Association. You can check out, I don't want anybody to think I'm trying to steal anybody's information or plagiarize or anything like that. You can check this out at the link that James posted. If you happen to be catching us on the watch party, that's where that is at. Otherwise, I will get it up on the main video page, maybe-ish. That's readmissions, that's Navigator, that's too many windows popping up here. I'm going to go ahead and grab James's link there. We're going to try to hop over to the main Navigator page. So if you're not in the watch party, I will be able to get it hopefully into the main video here. But we'll talk about where some of these things are, and looks like they're talking about myths and facts as related to COPD and COVID-19. We'll try to summarize a little bit here. Comment and paste. There we go. All right, so if you're watching in the video, you should have access to that now. But let's take a look here. Myth number one, stop taking oral, inhaled, or intranasal steroids due to increased COVID-19 risk. Definitely do not do that. Control is the most important thing for your asthma and allergic rhinitis, as Dr. Mora is saying here. You never want to change, whether it's add, subtract, fiddle with the dose, anything like that. You never want to do any changes without consulting your clinical team, whoever prescribed that for you, whether it's your primary care provider, your pulmonologist, whoever. So you may see in the news, okay, so they're saying that, these folks who have this COVID-19 disease and they're on the ventilator and we're giving them steroids and they're having worse outcomes. So then it's real easy to interpret that as, well, I'm taking a steroid, I should probably stop that. And we do not want that to happen at all. And she points out here, do not stop or avoid taking your medication without discussing with your healthcare provider. You definitely want to maintain whatever level of control, whether it's asthma, COPD, whatever. You want to maintain whatever level of control you have, because the absolute last thing you want right now is to go to the emergency department that's chock full of people who might have COVID-19 and might be exposing you to it. Myth number two, a little bit more toward asthma. Children with asthma are not at risk because COVID-19 only affects older people. It's a respiratory virus. It has been attacking some younger people, particularly here in the U.S. So here's an excellent one. This goes to the mask issue. If you have asthma, you should wear a disposable mask when in public areas to help limit COVID-19 exposure. Her take on this is masks should be reserved for people who are sick and healthcare workers who are at increased risk of COVID-19 infections. And that is generally true because we're having a shortage of masks, N95 and surgical masks right now. So if you have respiratory symptoms like fever, sneezing, cough, shortness of breath, you should wear a mask to prevent spreading your droplets to others, and as much as possible, stay home. Now, again, in general, that's pretty solid advice. However, it's also true that, especially if you have more kind of the chronic bronchitis side of COPD, you're going to be coughing and you're going to be doing those things on a regular basis also. So you probably want to consider wearing a mask, if for no other reason than people don't look at you funny, or we've been hearing a lot of terrible stories about people who are getting shamed and yelled at and all that kind of stuff by going out and coughing and doing all that stuff without a mask. So that one I wouldn't necessarily assign pro or con, myth or whatever, but at any rate. Myth number four, smoking, vaping does not increase your risk of getting sick with COVID-19. Cigarette smoking and vaping both linked to lung inflammation and lowered immune function, potentially heighten the risk for a more severe response. So obviously, that makes sense. Albuterol or other quick relief inhalers can cause the immune system to be suppressed, and as a result, patients with asthma are more susceptible to COVID-19. Absolutely not. That is absolutely false, of course. Asthma or albuterol is not a steroid and has no anti-inflammatory properties to it at all. It's a bronchodilator. Does a similar function, but in a completely different way. So again, do not stop taking your controller medications unless you talk it over with your clinical team and you actually have a darn good reason for it. Anti-inflammatories, again, other than corticosteroids, worsen COVID-19 symptoms. Not enough scientific evidence to link the use of NSAIDs, which are things like ibuprofen, to worsening symptoms of COVID-19. So, it might not be the first thing I'd want to do, but if you aren't able to take other pain medications or things like that, talk it over with your clinician. Number 7, using nasal sprays may push the COVID-19 further up your nose. Absolutely not. You want to, especially since this is now also allergy season, you want to continue using those medications as appropriate. Last but not least, exercise puts patients with asthma and COPD at higher risk of COVID-19. Absolutely not. You want to make sure that you're continuing to do as much exercise as you possibly can, because I know it's difficult when it's still kind of cold. You can't do a lot outside. You can't go to the gym, all that stuff. We talked again yesterday about walking in place, doing things with soup cans or hand weights, whatever you got around the house, walking up and down the stairs a couple of times. Doing all those things, that's what's going to help you the most. Staying active, keeping your symptoms under control, all that fun stuff. So, are you seeing people with coronavirus in the hospital? James is arguably a little bit more on the quote-unquote front line than I am. I work in a primary care clinic, and I have not yet been retasked to go into the hospital. I would not be at all surprised if that's coming based on some of the projections we're seeing for the next 2 weeks. So I do not personally see COVID-19 patients in the hospital as of yet. I am in close contact with a lot of therapists from around the country. And as a matter of fact, there was an article today from a absolutely top-notch therapist, a critical care specialist from Chicago by the name of Brady Scott, who said that honestly, everybody is truly overwhelmed right now. I know there's been a lot of talk. I saw one of the craziest things I've ever seen on Twitter today. There's apparently a challenge going around because there are certain elements out there that don't believe that this is a thing, that don't believe that hospitals are being overwhelmed, and they're going out and they're taking pictures of these hospitals that look very quiet or abandoned or everything is calm and all that stuff. And there really aren't words for that. I mean, there are people who are using this for weird purposes, and it's just unconscionable. This is a real problem. It is true that there were a lot of folks, including myself, that did underestimate how badly this was going to spiral. We can talk all day about why it's spiraling or all that kind of stuff, but at the end of the day, there are people out there who are completely overwhelmed. There are people who are making unimaginable decisions. There are people who are fighting every day without enough equipment, without enough protection. So take this seriously. Again, we talked a little bit about the groceries and things like that. I don't think you need to go too bananas over some of that stuff. But again, using your common sense, keeping things as clean as possible, keeping your hands as clean as possible, being diligent without being maniacal, I think the word was, that's what's going to get us through this stuff. So it is a thing. People are being overwhelmed, clinically speaking, and stay home wherever you can. Advise your friends, family, peer group, all that stuff. Stay home. Don't go to big gatherings. I've seen parties. I've seen church services, dozens, hundreds, supposedly even 1,000 people. Don't go to those things, especially if you are, or if you know somebody, or if you care for somebody with a chronic condition that puts them at risk for a compromised immune system and therefore higher risk of infection. Just don't do it. James, exercise is key. Yeah, absolutely. And again, we talked yesterday, there's stuff on YouTube. There are a couple of different groups out there doing online stuff. There are various gyms that are putting yoga programs and other motivational programs and all that stuff online. Take advantage of it. If you're watching this, you can go hop over to YouTube or switch the channel on YouTube, wherever you're at. Go check that stuff out. Provided patients with TheraBands to help them do chair exercises at home while watching Netflix shows. Highly encouraged. Make sure you focus on good breathing techniques with each maneuver and use your oxygen as prescribed. fantastic advice. Can't say it any better. I mean, just cannot say it any better than that. So thank you, James, for putting that in there. Stay as active as possible. Stay as social as possible. You know, we've talked a couple of times about this idea of social distancing and whether we should use that phrase or whether we should use physical distancing or what we should use. Be social, but at a distance. You know, again, make sure that you're staying. If you absolutely positively have to be in public with people, stay 6 feet away. Again, to use Meyer as an example, they've put tape on the floor at the check lanes. They ask you, you know, don't stand closer than a cart length. You know, don't get too close to people because that's where things are bunching up and all that. Try to avoid all that. Yeah, it's common sense kind of stuff. But remain social so that you don't get into this anxious, depressed, isolated spiral. So, yeah. Kelly Becker checking in from the upper level of Mucophile Studios. Kelly Becker is a nurse practitioner extraordinaire. I am slightly biased as I happen to be lucky enough to be married to her. But she is also checking in, giving James a lot of credit for the advice because it is absolutely essential. Stay active, stay social, stay engaged. Binge those Netflix. If you're going to binge while you're active, binging while active. All apologies to binging with Babish out there. So who else has, we've got a little bit of time left. I plan on sticking around until about 5 o'clock. So I'm going to scan around here and see if we've got some other questions popping up in the various other outlets. Again, if you are catching this, if you're not familiar with this whole routine, we do have a Facebook group called COPD Navigator. Someday, probably in the next couple of weeks, as I have a little bit more time to devote to that, building up the website a little bit more. Let's see what else we got here. We got like I said, the Twitter feed. We got all kinds of fun stuff. So, what else we got? So it looks like the questions might be tapering off a little bit. So stick around for a few more minutes. Again, and this doesn't even have to be just question and answer time. Again, we want to make sure that people are staying social. This is one of the best things about Facebook is that you can have some degree of socialization. Sometimes it's what we call asynchronous or not at the same time, but sometimes we can have this interaction talking back and forth. One thing you could do if you know some other people, you can have group FaceTime or there are a lot of web conference softwares out there. Zoom, I understand, is one of the better ones out there, a little bit more user-friendly. That's one. It's a little bit newer. I usually use things like WebEx or BlueJeans, stuff like that. So I'm a little bit more familiar with that. But I understand that a lot of folks are doing Zoom get-togethers. I saw a thing about a Zoom happy hour one time where everybody's just kind of being social and maybe having a little beverage or two. We live in a time of fantastic technology where we can still interact with a lot of people, but not have the risk of this kind of stuff. But so I'll be sticking around here for a few more minutes, just again looping through to see if we have any other questions popping up. And again, if you are more interested in catching some stuff through the YouTubes, as I believe one of the presidential candidates was mentioning the other day, yeah, we are live there. Okay. The monitor's acting a little bit weird today. I've lost like my red channel. So, there we go. That looks a little bit better. So, we really quieted down that much? Well, in any event, I am going to be here here all week. Make sure you tip your wait staff, all that stuff. do have, I suppose, a tip jar that I'm supposed to be out there. I don't know if that's really worthwhile or anything like that, but came with the setup here. So I guess if anybody is inclined, who knows what Healthy Air is going to be looking like in 6 months, right? Yeah. So I am definitely going to be here all week. James, have to run. Great topics, fun to discuss. Thank you, sir. Be safe. You do the same. Be well, everyone. See you soon. Be here all week. 4 o'clock Eastern time. Whoops. No, do not want to leave that just yet. So, though I suppose if nobody else has any questions, we can always save them for tomorrow. And tomorrow also we'll be dropping a new episode, more than likely, of my new podcast called the Potato Cast. A little bit of a breather from some of the connection is a little bit weird today. Sorry about that, Linda. Hopefully things are coming through for most folks, but in any event, I'm dropping a new episode of my new podcast. If you're looking for a little bit of a breather from the COVID-19 stuff, there might be a brief mention of it, but this is going to be a discussion of looking or asking the wrong questions leading to the wrong answers, which is a problem a lot of times in medical research. We talked a little bit earlier about we focus on things like getting spirometry done, but we don't always focus on the fact that it has to be high quality spirometry. We look at wearing a mask, but not necessarily wearing a mask properly, or wearing gloves, but not usually wearing gloves properly. So there's a lot of these confounding factors and cognitive biases and things like that. I'll dive into that a little bit. The Potato Cast, as I call it, is the America's #1 podcast, healthcare podcast named after a cat. One of my cat's names is Potato. And I've got a nice picture of her talking into the microphone. So a friend of mine thought it would be a great idea to call it Potato Cast. So thank you, Elena. Also came up with the idea for the name for Breathe TV, if I recall correctly. So, there we go. So look for that tomorrow on. We have a website. It's Pinecast. It is the podcast hosting site, but you can also find it at Google Podcasts, Apple Podcasts, Spotify, a couple other different places. If you happen to be a podcast person, you'll find it wherever you find your podcast generally. And if you have a place where you're looking for it and can't find it, please let me know. We got the email address up there, breathetv@copdnavigator.net. We've got Twitter. As I mentioned, you can tweet at me. You can drop it in the comments, either here or on YouTube, here on Facebook or on YouTube. It used to be just a Facebook-only show. That's why I keep saying here and et cetera, et cetera. But look for wherever your finer podcasts are released. So, all right, still no more questions, so we'll go ahead and wrap up a little bit early tonight. If you know of anybody who is in need of some best practice advice, again, not medical advice, not clinical advice per se, can't advise specifically on a case, but if you have some questions, please feel free to share our page on Facebook, our channel on YouTube, both of which go by COPD Navigator. Let's build up this audience a little bit, because again, once Corona is handled, COPD is still going to be here, and we still need people to join the fight so that people are aware of COPD. We can increase research funding and research attention and all that stuff. Let's fight together. So we will sign off for today. Hope everybody has a good rest of your evening. Thank you, Sean, for checking in today. Appreciate you. And make sure that you are taking care of yourselves, taking care of each other, so that we can meet up again tomorrow at 4 p.m. Eastern Time for another COPD Navigator house call. Till then, keep breathing easy, everybody, and have a good night.